In our first community conversation, we're joined by Dr. Gregg Eure, a urologist with UVA Health. He's sitting down with Aaron.
Dr. Eure, it's great having you today. Thanks for coming in.
Thank you for having me, Aaron. Appreciate it.
You're very welcome. So today we're talking about benign prostatic hyperplasia, also known as BPH. So what exactly is that and how is it diagnosed?
Sure. BPH is a fancy word for enlarged prostate, basically. So us men, as we age, about half of us, the prostate enlarges, and about half of them get symptoms. So it's a big chunk of the population. Symptoms include frequent urination, stop-start, hard time getting started, feeling of incomplete emptying, and getting up multiple times at night. So we're very fortunate at Culpeper UVA Health to have a Center of Excellence in BPH that they have supported. And it really gives us the latest diagnostic tools and treatment options that we'll get into.
Very nice. And what are some of the health effects of BPH?
Yeah, I think that's an important issue, Aaron. Men think, it's just a consequence of aging, that prostate enlarging, and it impacts quality of life. But there can be some damaging things behind the scenes. So they can get urinary tract infections, bladder stones, kidney damage, and bladder damage, which is one we'll talk some more about as well. We're very fortunate, too, to have a cutting-edge diagnostic device that we'll talk about.
Okay, so let's talk about treatment. So we're interested in learning more about, is it pronounced aquablation?
Yes,
aquablation. Okay, so what is that? How does it treat BPH?
Yes, fortunately, and just to get back on the diagnostic part, we really try to personalize the treatment to the patient. So we use diagnostics. We have this thing called Care Path, where we send the patient home with this device. They void through, goes in the toilet, and through a secure connection to a cloud, it'll tell us how strong their stream is, how much their bladder holds, how often they're going, and those things can really help us decide what treatment option is best for them. So one option we have now, very fortunate, called aquablation, and what that is, cutting-edge technology that uses robot-assisted high-pressure water, kind of like a power washer, if you will. And it also uses advanced imaging and artificial intelligence, so we map out what part of the prostate we want to get rid of that's causing the problem, and the important part to save to help preserve sexual function.
Okay, and how does it compare to other treatments for BPH?
Yeah, so again, we have different options, depends on size and shape of the prostate and the diagnostics that we come up with that individual patient. But the aquablation is nice. It's an outpatient procedure, generally takes just over an hour. Patient is asleep, but if things look good, we watch them, make sure all is going well, and then send them home to the comfort of their own home instead of the hospital. It's been really good. The patients have recovered well. They're going home without, narcotics or heavy medications, and the durability has been very good with it. I've been fortunate. I was part of one of the original FDA trials that looked at the longevity of this treatment, and those original patients I treated in that FDA trial are still doing well now, 8 years out.
Wow, so it sounds like a pretty successful treatment.
It's been we're very fortunate to have it.
That's wonderful. Well, thank you so much, Dr. Eure, for coming in today. It was great having you here.
Thanks. And just a parting note.
Yes.
I think if, for men to keep in mind that there are only two organs in the body that we can't transplant. One is the brain and one is the prostate. One is the bladder, I'm sorry, which, bladder health is important and impacts the prostate. So
right.
Appreciate it.
Yes, of course. Thank you so much, Dr. Eure.
Thank you.
Steve, over to you.